Welcome back to another PT Pearl. I'm Dr. Dom.
I'm Doc Jen.
And today we're going to talk about plantar fasciitis. So that heel pain you might be getting, why you might be developing that, and some ways that you might be able to approach helping it feel a little better. So stick around and figure out how to help that heel pain. Yeah, so plantar fasciitis, if we're going to dive right in, what is it? You know, it's this really common heel pain that you'll get kind of on the bottom of your foot, right kind of where your calcaneus, which is that big heel bone, meets all of the tissue that run right on the arch of your foot, on the bottom of your foot. So that's kind of where our plantar fascia is, and where we feel the fasciitis is right kind of locally. Most people that feel it can just put one finger on it and say, here's where the heel pain is. So right on the bottom kind of your heel. Mm-hmm. And people will tend to get that because what we used to think is we called it fasciitis, meaning inflammation, that itis ending, acute inflammation more specifically. And what we're finding now through a lot of the tests is people who have this plantar fasciitis pain, they don't have as much inflammation in the heel. They have tissue changes of the actual structure, whether it's thickening or slight bone changes that we're going to talk about. So fasciopathy makes more sense. And I love that we're talking about this topic because we have an interview that we're going to talk about fascia coming up. And we also talk about tendonitis and tendinopathy in a PT Pearl a couple PT Pearls ago. So if you go listen to that one, or if you did listen to that one, that'll kind of be relevant here as we talk through plantar fasciopathy, which is more accurate of a term for this.
And, you know, people often complain of having or experiencing heel pain, plantar fasciitis, all of these types of things, usually after rest. So it's usually first thing in the morning, you're putting your foot down and you feel that like really sharp pain down at the bottom of the heel.
Risk factors, which kind of will all bundle together. Like clinically, we find that the plantar fascia has thickened a little bit, right? In people that have symptoms, we find a slightly thicker plantar fascia on the side with the symptoms versus the side that doesn't. So, okay, we see that. However, it doesn't correlate to pain. Same thing as a heel spur. A lot of people will say, oh, I've got this huge heel spur on the right. That's why I have this plantar fascia. Again, it's not why you're having pain, but people who do have plantar fascia pain present slightly more often with this heel spur. So we'll see these things again. That's why we want to call it a fasciopathy, but that doesn't correlate to the level of pain you have. Worse heel spur or thicker plantar fascia does not mean that we will have worse pain.
And a heel spur is?
A heel spur is just kind of a growth of bone right on the bottom of that heel bone or our calcaneus where we're having the pain. Yeah. So a lot of people like to say, oh, I have a heel spur. That's why I'm having all this pain.
And we just tend to land more in one side versus another. Now, some people are born with flat feet. It doesn't mean that you can't work your feet. It doesn't mean that you can't work the muscles of your feet. So just because you have flat feet doesn't mean that you should give up.
Yeah. And another thing with when we say there's no inflammation, that doesn't mean that along the process, there's never anything that puts inflammation in the feet, right? Those tissue changes generally start to happen because there's inflammation at one point or another. But because our feet and that plantar fascia is so thick and strong and has such great integrity, we might not even feel that pain initially when we're just getting that inflammation because our body's trying to build and respond. And it says, okay, great, let's strengthen up, let's build this. By the time we've overloaded that tissue and grown it to a point where it might be impacting the symptoms or it might be impacting that chronic experience in that foot, we're not having as much inflammation. So it doesn't mean that there isn't inflammation at one point or another.
Right, exactly.
But probably more towards the beginning, and we might not even be having symptoms at that point.
Yeah, you probably don't even feel it. So by the time you have symptoms, that's why it's hard to say that it's now a plantar fasciitis because it's not an acute account of symptoms. By this point, it's more of a chronic plantar fasciitis. And so that's why the name of it now is shifting more toward plantar fasciopathy. And if we start to think about it in that way, and we can't, again, just because the tissue is thicker doesn't mean that you can't find another person who has super thick fascia on that side and has pain. So why are you having pain and what can you start to do about it is what we really just need to start focusing on. So
what are some of the things that don't work as much for plantar fasciitis?
One of my fave, because it's always been like, I know this doesn't work, but it's if you want it, okay. Yeah. And this is one of the things that drove me out of the clinic as well. Ultrasound. I'm sorry if you like to go to your therapist because you love that ultrasound, go for it. Go do it. But honestly, the research is showing that it is the same as like a sham treatment at this point. Again, we don't have that acute inflammatory response. The ultrasound is not going to do enough to actually affect the thickening of that tissue and create long-term change. Same with the low laser treatment. Which honestly, at the clinic I was at, those are the two things that I would see done the most is laser treatment and ultrasound, and especially with diagnoses of plantar fasciitis. And it always drove me a little nuts, but it was something that people would see all the other therapists doing. And so if that's what everyone else is doing, that's what I need for my body as well. Research is showing it's not really doing much of anything.
Yeah. And so another one that people might tend to want to go to or get recommended to them would be an injection. Mm-hmm. Oh, I've got
PRP.
this plantar fasciitis. Like, let's just have an injection and fix it.
Yep.
And I think in the research we saw, it said multiple injections actually increases your chance of rupturing or further injuring your plantar fascia.
For the corticosteroid, not for the PRP.
Yeah, for corticosteroid injections, so steroid injections specifically.
Yes, because we know multiple steroid injections is going to disrupt the tissue itself. So if you want to try it once and kind of have that local pain somehow try to go away, you can try it, but again, research isn't supporting it. And second, you shouldn't have more than one in that area. 2, PRP is not even very supported in the research for plantar fasciopathy right now.
Again, because in fasciopathies, and this makes sense to me, we might not ever change the integrity of that tissue again. Mm-hmm. The same as we talked about a couple of PT Pros ago. Once it gets to a true fasciopathy, chronic fasciopathy, we might not change the thickness of that tissue. Mm-hmm. So PRP is not going to help because PRP is meant to help stimulate healing. But you can only really do that if it's in an earlier stage of that tendon change, right?
So there's a possibility, but you're gambling with a really something that's still being studied, and you might not know what level you are along that tissue change. And if you want to go back to understanding the levels of how that tissue changes, again, go listen to that episode because we really go into detail on that.
Splints.
Oh, orthotics.
Splints and orthoses. A lot of the research that we saw on splints and orthoses, because everybody wants to run and get an insert that's going to take away your heel pain or take away your arch pain or whatever it may be. And it showed that long term, there was not much more improvement compared to other more effective types of treatment with splints and orthoses.
Exactly. And that's where I always say too, people always try to search for the answer that's going to be the external fix rather than the internal fix. And the internal fix is what you're actually doing to support your own tissue, not relying on something else.
Yeah.
So again, if it makes you feel better, if you have a release of pain in the beginning, sure, use it, but you cannot neglect what you're also getting in treatment in terms of what your physical therapist is telling you and some of the treatments that we're going to show today. But I do want us to touch on deep tissue massage.
Deep tissue massage.
Really getting those knuckles in and
so you can break up the plantar fascia, right?
Yeah, breaking up that plantar fascia and everything that's happening down there.
It's almost as easy as breaking up the IT band.
Which if you haven't listened to the IT band, go back and listen to that one as well.
Yes.
Because it just doesn't work like that.
Yeah, and we'll talk a lot more with Jill about that. But now working into a couple things that might actually work to help long-term with plantar fasciopathy pain. One of the first ones that we looked at, and we'll talk a little bit into this, is called extracorporeal shockwave therapy. Mm-hmm. Extracorporeal shockwave therapy, and it's just basically real intense shocks, and you actually need anesthesia, so you need numbing when you have this procedure. And they have, it's at an 18-minute shock procedure that you go through, and they'll have you go through this course of this shockwave therapy for 12 months, right? And they've shown to take down the visual analog scale, being people's pain or what they're perceiving that pain they're having in their heel, and it takes that down over 12 months and keeps it down consistently.
Yeah. So if you're between, getting a shot versus doing the shockwave therapy, better research is showing that the shockwave therapy is actually becoming more effective. But again, what we are doing with that is covering up symptoms. We're helping symptoms to feel better. Now we could be creating real tissue changes.
Yeah.
But why did that start hurting in the first place? why did my plantar fascia start to hurt? Why did my heel start to hurt? If I'm just talking to the pain signals and the tissue at the area, and after a year of doing this therapy, it feels better, great. How do I know it's not going to go back into that? And that's where we have to, again, be building in that internal.
And so then the next intervention that works that we would really recommend is kind of twofold, because there's two parts of it. One was loading or strength training, slow, high resistance strength training. And the other was movement, mobility, and self-stretching and stuff.
Well, yeah, but I mean, that all falls into the same area of load.
Yeah,
you have
loading
to load
the
tissue. And slow, high resistance strength training still starts when we talk about slow. That means I'm going to gradually progress it into the strength training aspect of loading the tendon. So the first tension of load is a stretch. So this is where stretching and strengthening still play a role into each other, and why we don't just separate them, because stretching is your first action to load the tissue. This is the most effective treatment. And voila. And so we're going to show you two exercises that they talked about in the research. One is just grabbing your foot, pulling your toe back, and giving that bottom of the foot and kind of almost that calf area. So kind of pulling that heel back as well, and getting kind of down into that lower Achilles, all the way up into that bottom of the foot. So you're just crossing your foot, pulling your toe back, and giving it that stretch. Now it's up to you to determine how much of a stretch that you can tolerate within your body. I will say again, I'm going to hammer in that you should be holding it for at least 2 minutes at a time, rather than just doing 10 to 15 seconds. And if you start to do this every day, you are going to start to notice a difference in the mobility and the tension of that tissue.
And then once something like that has been something you've been doing a little bit, doing more load, like Jen said, by getting on your toes and using your body weight, is the next thing we're going to show you. So if you take a little towel, and Jen's going to stand up and use my head as a balance if she needs it. But she's just going to put her toes right on the edge of this towel.
You hopefully wouldn't be on a squishy surface like
Yeah, she's standing on our therapy table, so it's squishy. But what this does is it bends her toes back and actually puts a little passive stretch into that plantar fascia already. So that when Jen goes up on her heels, she's putting just a little bit more load, and then she can go back down than if she was going up on her toes on flat ground, because her toes are just held up a little bit by that towel. So it's a good way to do that toe raise and just increase the input or the strain through that plantar fascia a little bit. Once you get used to that, you can start taking weight out of one of your legs on the way down. So she will come up on both toes, raise the heels, come off of one foot a little bit or all the way, and control that weight down with just 1 foot. So then you're putting basically that whole load of your body weight through one plantar fascia. And that's an easy way to really put a lot of load through there without using any weights or without going to a gym.
Exactly.
It's something you can do right at home. You can do it on a stair or on a step. And so there's lots of ways you can just start doing this at home.
Heel raises, lifting up the toe a little bit more, and really the most focus of that, as always, for any heel raise you do, even if you don't have a towel underneath the toe area, is literally just making sure that you're going slow on the way down. So this is called building that eccentric strength. So eccentric means that we're lengthening the tissue. So think about it as we come up into a full movement, or heel raise. That's kind of your concentric contraction. Then as we start to come down, we are lengthening and still building strength and tolerance. So we go nice and slow on the way down, and it kind of gets that whole calf area, Achilles, and then all the way underneath that plantar fascia. One of the other things that one of the other studies were showing too, you have to keep up with these. You can't just do it for a couple of weeks and be like, it didn't work.
Yeah.
How long do you think it took to build up in plantar fasciitis? How long or fasciopathy?
Right.
And how long had you been doing it? How long, have you been loading these tissues and not thinking about your feet and not working into your toes? it's going to take time. And these are not the only two, okay? These are two that have been studied, but there's so much more that could be happening within your individual foot that you need to assess, or you need to go get assessed and kind of see. These are just two examples of what they talked about in the research. But the other thing, you have to assess how you see 24 hours later for any kind of exercise. So say you want to start to do things a little bit more, you want to start to walk a little bit more, okay, go do it, see how you feel 24 hours later. If it gets worse, then we know we need to modify a little bit more. Same with running. They were also recommending that you don't go run until you don't have pain for 4 months. 4 months is a long time for a lot of people. So just being very mindful of that you're not just going to, oh, I'm feeling better, it's been a couple weeks, I'm just going to go run. No, actually continue to build into those practices, into those tissues, into the exercises that you're doing while you kind of start to wait out this period. In 4 months of your life, you can do it. I know it's hard for some people who love running, but it's possible.
And that might be the toughest part of the whole thing, is not being able to do the things you normally want to do.
Yeah.
Doesn't mean you can't do anything, because there are hundreds and thousands of things that we can always do to move our bodies. But we might just have to modify for a little while.
That's
and like
okay.
Jen's saying, tendinopathies, 6 to 12 months to make really good lasting change and change some of those patterns within running or within whatever it was you were doing that might have resulted in that developing. So give it time and give your body a little grace for that journey.
Thanks for joining us on another PT Pearl. We love having you guys, and we love hearing your feedback, what you're learning, if you're experimenting, if you're trying out these exercises. So comment below, let us know, share it with a friend, and we will see you next time.